Welcome to Thursday's edition of COVID-19. Korea is exploring its options of transition from a tight containment of the pandemic to a more targeted strategy that allows for a gradual resumption of normal life in the absence of social restrictions. We have details on that later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so contrary to earlier concerns, there has been a slight decline in our daily tally here.
Right, Sunny, and that has brought Korea's daily caseload to below the 2,000 mark, 1,943 to be exact, as of 12 a.m. this Thursday. And that includes 1,921 domestic transmissions and 22 cases from abroad. So following Wednesday's hike, we are seeing a drop by around 130 cases from yesterday. And also compared to last week, we are seeing an on-week drop as we were at above 2,000 last Thursday. Korea is now approaching 280,000 infections in total, with a death toll at 2,386. Now, infections in the capital region remain the biggest struggle in recent days. As of 12 a.m. this Thursday, 78.4 cases of domestic transmissions occurred in the greater Seoul area. So for a closer look, the capital Seoul reported its second highest ever daily infection toll at 719, followed by 656 in Gyeonggi-do province and also more than 130 in Incheon. Meanwhile, also over 50 cases, or exactly 50 in Chungcheongnam-do province and more than 50 in the city of Busan. Now let's move over to our vaccination updates. Almost 35 million people have received at least one shot of COVID-19 vaccine, and 41.2% or 21.1 million people are fully vaccinated. Let's move on to some global updates now. According to the World Health Organization's weekly assessment of the COVID-19 trend, there's been a decline in global cases, as between the 6th and 12th of this month, there were a total of less than 4 million cases reported, and in recent weeks that figure was at way above 4 million. So that represents the first decline in around 2 months. Meanwhile, countries like the US, UK, India, Iran, and Turkey have seen the highest caseloads in that span. So why don't we take a closer look at these countries now? The US here at 42.4 million, followed by 33.3 million in India, and then the UK at 7.3 million, 6.7 million in Turkey, and 5.3 million cases in total in Iran. And the total number of infections around the globe stands at 227.2 million. Those are the updates I have for now. I'll see you back in a bit. Sunny?
All right, so as always, thank you for now then. Up next, officials are looking to address the plight faced by small and mid-sized businesses amid the pandemic by easing their financial burden for the time being. For more on this, I have Chang Taeyeon here in the studio. Taeyeon, welcome.
Good afternoon.
Right, so authorities have extended deferment periods for business loans, I hear.
Yes, Sunny. So Finance Minister Hong Nam-ki on Thursday announced an extended pause on both principal and rollover interest payments for state loans borrowed by SMEs for the next 6 months. The deferment will be in effect until next March. This comes on the back of debt relief measures announced on Wednesday by the Financial Services Commission, which will be provided through commercial banks and other financial institutions. As a matter of fact, this is the third time that the government has pushed back the repayment date for small business loans. From last April to July of this year, some $190 billion worth of state loans had been taken out by SMEs. Also, with many businesses in need of taking out fresh loans to refinance their debt, some experts have questioned the wisdom of continuing to lend money to small business owners who can barely afford to pay off their interests.
Which is, of course, a very valid concern, Taeyeon. Meanwhile, I hear we're looking at some tentatively favorable figures on the job market.
Well, despite the fourth wave of the outbreak, Korea saw higher on-year job figures for the 6th month in a row in August. According to Statistics Korea on Wednesday, around 27.6 million people were employed in Korea last month, up roughly 518,000 on year.
Despite the toughest social distancing level in the capital area and virus prevention measures, employment improved in August thanks to robust exports and the base effect from the previous year.
But the pace of growth has slowed for the fourth straight month. The jobs added in August were around 24,000 fewer than the increase in July. Looking closer into the job market by sector, wholesale and retail, food, and accommodations industries were the biggest underperformers, shedding more than 151,000 jobs in August compared to the previous year. But improvements were seen in other sectors, such as public administration and healthcare, which added some 290,000 jobs on year.
Right, I see. Taeyeon, what about corporate earnings, that is? I hear they're riding quite high.
Right. Well, many companies enjoyed bigger revenues in the second quarter, even amid the fallout of the pandemic, and were also more profitable. It's partially thanks to exports. According to the Bank of Korea on Wednesday, the ratio of operating profit to sales for listed Korean firms was seen at 7.4% during this period, an increase of 5 percentage points on year. The collective revenues posted by Korean firms rose 18.7% on year compared to 7.4% seen last year. When broken down by sector, manufacturing companies saw a 24.3% on-year jump in revenues during the second quarter. Metal products saw a more than 40% increase, and for oil and chemistry, more than 33%, followed by transportation equipment and semiconductors. Sales by non-manufacturing firms increased by 12.4% in Q2 on year. The biggest gain was seen in the transportation sector with a more than 35% rise. Other industries also posted gains of more than 10%, respectively. A Bank of Korea official said COVID-19 is still weighing down on revenues, but local firms are nonetheless finding ways to thrive amid the pandemic.
Well, that is good to know, Taeyeon. Okay, thank you very much for the updates on the economic front.
My pleasure.
Meanwhile, on the pandemic front, the government has shared its weekly numbers of variant cases and breakthrough infections. I have Soa back at the desk with details on that and more. Right, Soa?
Right, Sunny. So why don't we start off with the breakthrough infections, which is infections among fully vaccinated people. And that has increased by 876 from a week ago, standing at a total of 4,731. It only represents a tiny fraction of fully vaccinated people, but 8 out of 10 such cases were linked to variants, and also with the highly transmissible Delta variant taking up the highest proportion of such breakthrough cases. Now, on variant updates, let's have more details by Lee Sang-won, a senior health ministry official at Wednesday's briefing.
최근 일주일간 변이 바이러스
29% of cases were analysed for the presence of variants in the most recent one-week period. The positivity rate was at 98.8%, with the Delta variant taking up a 98.5% portion. 3,460 new variant cases were confirmed, which includes 200 imported cases and 3,260 domestic transmissions.
With that, Korea has a total of 26,800 infections from the 4 major variants, with the Delta variant accounting for close to 23,400. And Sunny, meanwhile, the weekly updates on the breakthrough and variant cases were usually made on Tuesdays, but it looks like they have shifted that to Wednesday's briefing.
Right, thank you for making that clear for us. Now, Soa, here, Wednesday's briefing also touched upon the importance of shorter social meetings among people.
Right, Sunny. A joint study based on a number of simulations conducted by the Korea Institute of Science and Technology and the Central Disease Control Headquarters tells us how much we can reduce the chance of catching COVID-19 simply by meeting people in a shorter period and also by frequent ventilation. So let's take a listen to an expert who had a detailed explanation on that.
By reducing gatherings with people you haven't seen in a while by around 40%, the chance of being infected with the virus drops by 33% a month and a half later. Simulation results also show that apart from reducing the number of gatherings, shortening the time of your meetups is also important. We estimate there's a 60% chance of infection when you spend 12 hours together, but the probability drops to around 35% when the time is shortened to 4 hours.
The study also detailed how the risk of infection grows in poorly ventilated places. While there was an 80% chance of getting infected in places where no fresh air is circulating, that risk dropped to 60% when ventilating twice an hour and down to 40% if ventilation was conducted every 10 minutes. If you're with an infected person for 12 hours in an unventilated location, the chance of contracting the virus was estimated at 78%, but dropped to 42% when ventilating in 10-minute intervals. The studies also emphasized the effectiveness of wearing face masks, especially when meeting with people in poorly ventilated spaces, showing a roughly 30% lower chance of an infected person transmitting droplets to others when wearing a KF94 mask. Now, this analysis also comes at a timely manner because we are just ahead of the Chuseok holidays, and officials are stressing that these calculations should help people in meeting their loved ones and going to their hometowns in a safer manner, and especially because we're having also that relaxation when it comes to private gatherings.
Right, fingers crossed for that. Now, Lee Sang-won, I understand, so I'll also address the definition of herd immunity under Korea's COVID-19 strategy. Tell us more about that.
Right, Sunny, because there seem to be some misconceptions when it comes to that term, because as with the high infection numbers, more and more people are losing their hopes that herd immunity will ever be achieved. So Lee Sang-won, the health minister official, had some more words regarding that.
The definition of herd immunity depends on how we interpret it. If it refers to a situation where masks and social distancing do not exist, meaning a return to before the year 2020, then herd immunity is difficult to achieve. What it rather means is if a lot of people are already immune against the virus or have been vaccinated, they can become the middle link to break the chain of infections and provide partial protection to those who could not get vaccinated or had to delay their shots.
So what authorities are trying to convey to the public is that it's not about whether herd immunity is possible or not, but rather to what extent it is possible.
I see. All right, so thank you for that clarification.
My pleasure.
A group of US researchers have made public an interesting phenomenon related to infection and inoculation. For more on their finding, Ji Abili joins me now. Ji, what do you have for us?
Hi, Sunny. So people who have recovered from a COVID-19 infection and then later received a dose of an mRNA vaccine seem to be much better protected from the virus. That is better than unvaccinated COVID-19 survivors or vaccinated individuals who never contracted COVID-19. Paul Benash, a virologist at the Rockefeller University in the U.S., led several studies on these individuals. He spoke about the findings in an interview with Reuters on Wednesday. Both Pfizer and Moderna shots are mRNA vaccines.
We've studied most closely those who were vaccinated using the mRNA vaccines, but it's possible that the same phenomenon would exist for other vaccines. And what really it consists of is a type of immunity that was laid down by infection and then strongly boosted by the subsequent vaccination.
Benash explained the combination of recovery from infection and inoculation produces antibodies at such a high level that they are able to neutralize mutants. That includes those that are circulating, such as the Alpha, Delta, and the other variants. Benash said he prefers the term hybrid immunity over superhuman immunity for the new findings, saying the latter was coined by a journalist. Now that leads us to the question of, do you need to have had COVID-19 to gain super immunity? Not necessarily, and that's why Benash and his team of scientists are looking into this option.
That is something that we're studying at present, whether a third booster shot can, at least to some level, mimic the effect of having been infected and then vaccinated. Thus far, it seems to be partially true that a third booster can, to some degree, mimic the effect of first being infected and then being vaccinated.
Right, well, that sounds like a subtle vote of confidence for booster shots. Speaking of which, Ji, there have been more words of support for this third shot, I hear.
That's right, this time coming from Moderna. The U.S. biotech company released more data on so-called breakthrough cases that support the push for a widespread adoption of booster shots. The drug maker's latest analysis shows the incidence of breakthrough COVID cases was less frequent in a group of trial participants who were more recently inoculated. This means immunity for earlier groups had started to wane. We do need to keep in mind that the analysis is yet to be peer-reviewed. The new data comes 2 days before a key FDA Vaccine Advisory Committee meeting, where a panel of outside experts will debate whether there is enough data to support a wide adoption of booster shots across the country.
Right, Jay, and I believe the Pfizer shared similar findings with the FDA
That's right.
on Wednesday, right, for the need for booster shots. Now, meanwhile, over in Europe, then, do tell us about the Catholic Church's stance on COVID-19 vaccines, G.
Sure, let's hear from the head of the Catholic Church, the Pope. Pope Francis on Wednesday said he was puzzled as to why so many people, including some cardinals in the church, have refused to get the jab.
It is a bit strange because humanity has a history of being friendly with vaccines. When we were children, we had vaccines for measles and other vaccines, such as for polio, and nobody protested. Then came all this, the protests against vaccines.
Aboard a plane returning from Slovakia, he said perhaps some people were afraid at first because there were various vaccines available and some turned out to be, quote, little more than distilled water. He didn't specify any names. Francis himself is vaccinated against COVID and has often urged others to get inoculated for the common good. He reiterated everyone in the Vatican are all vaccinated except for a small group. Over in the U.S., Cardinal Raymond Burke, a conservative and a vaccine skeptic, was hospitalized last month after contracting the virus. Some conservative anti-vaccine bishops have said Catholics should have the right to exercise conscientious objection to the vaccine on religious grounds. But the Pope has made clear in the past that he disagrees. That's all from me today. I'll see you tomorrow.
All right, Jay, as always, thank you very much for the coverage. Right, staying on the international front, authorities in England this coming Sunday will mark 2 months since their declaration of Freedom Day from all legal COVID-19 restrictions. For more on this situation, I have David Cox live on the line. David, it's been a while.
Hi, Sunny. It's great to be back on the show again.
Right, so do start by sharing with us some of the activities that England has been indulging in the absence of COVID-19 related regulations, David.
Yeah, so life in the UK is completely back to normal now. We've had a really successful vaccine campaign over the past few months. I think 80% of adults in the country are now completely vaccinated. And so, yeah, basically social distancing is no longer happening. Cinemas, nightclubs have all reopened. People are going back to sports stadiums again. Schools have resumed as per normal and face masks are completely optional. So, yeah, basically life is almost as it was before COVID at the moment in the UK.
Right. What about travel restrictions, David? What's the latest there?
So the UK has this traffic light system. So we have green, amber and red. So people can go abroad, but for certain countries, you have to go through like a level of restrictions to then get back in the UK again, or you'll have to do a PCR test to be able to get back in the UK.
I see. David, what has been the response to the lifting of restrictions there, especially in light of the reality that daily cases continue to hit some 30,000 in the UK, right, David?
Well, yeah, that's true. But I think at the moment people are very optimistic about COVID because while we do have 30,000 cases a day, that has been fairly stable for the past 2 months since Freedom Day. I think what's perhaps concerning people a little bit more is that the daily death toll just in the past couple of weeks has started to creep up again. And so there's some people who are a little bit worried that as we approach the winter, COVID plus other seasonal viruses, the NHS might come under pressure again. But I think mostly at the moment, people are feeling very optimistic about COVID.
Right, and you have officials highlighting the importance of vaccination, of course. Now, some 81%, David, of the UK population has been fully inoculated. And come this month, that is late this month, I hear healthy children aged 12 to 15 will receive their vaccines. Could you tell us a bit about this initiative?
Yeah, so basically, it's just been announced that now, all over 12s are going to be offered the vaccine. It's for a couple of reasons. I think because children themselves aren't that young, aren't that particularly at risk of dying from COVID, but they do play quite a key role in transmitting it within society. There's been quite a bit of data which suggests that teenagers in particular play quite a big role of in terms of spreading the virus. And we know that being vaccinated does reduce the transmission by about 50%. So that's the rationale behind that. Another point as well, which is a little bit less of a factor, is the fact that a small proportion of children who get COVID can develop long COVID. And there's been quite a bit more attention on that in the past couple of months. So, but most of it is to try and reduce the spread within the society.
Right. David, I understand children will be offered a single dose as opposed to 2 doses. Is there a reason for that?
I think it's just basically scientists being a little bit cautious about vaccination, because there have been a few studies, particularly in the US, which have suggested that some children can develop heart inflammation resulting in the vaccine. I know it's a very, very rare side effect, but I think there's just like a little bit of caution, particularly with the younger children at the moment.
Right, myocarditis, right?
That's right, yes.
Also, right, David, also starting this week, booster shots will be administered to those over 50, those with health conditions and frontline workers. How have UK authorities sought to explain their stance on booster shots, especially keeping in mind the global health body's calls for a moratorium?
It's true. I mean, I think it's always a difficult situation, isn't it? Because you want to protect your own, but at the same time, we do need to try and focus on getting the vaccines to the rest of the world to prevent the spread of further variants. I think at the moment, well, the vaccines are very good at reducing the risk of people becoming seriously ill and dying. They aren't perfect, and over time, their effectiveness can wane. So this is where the boosters can come in. So I think what the government wants to do is to try and top up protection in the over 50s and in younger adults with health conditions. But I think the other key point which the government are trying to do at the moment is, because there's still about 5 million adults who just haven't had any dose of the vaccine at all. So we still need to try and reach those people and somehow convince them to have at least 1, if not 2 doses of the vaccine.
Right. David, earlier on Tuesday, Prime Minister Boris Johnson spoke about a plan B for England if the COVID-19 situation there aggravates. What does this plan include?
Well, the government wants to avoid lockdown at all costs this winter. So I think that's the main rationale behind that. So the plan A is the vaccines, this including the rollout of the boosters and the jabs for children. But currently, I think around 7% of hospital beds are still filled by COVID patients. So that increases too much, and COVID cases are really impacting on other care. Some restrictions are basically going to be reintroduced. They're calling it like a lockdown light. So what will happen if that's the case? So face coverings will become mandatory again in indoor areas. You'll have COVID passports to get into stadiums, for sports matches and things like that. And I think most companies will order people to work from home. So that's what's going to happen, but it's not going to be anything like the lockdowns we saw last year.
I see. Do you suppose that kind of stance by Mr. Boris Johnson, that is, would actually encourage the public to make more informed decisions about actions, regardless of the ease in restrictions?
I think so. I think that's what he's hoping to do, just by highlighting the fact that COVID isn't over. It's still very much present, and also as well because last winter we actually got a little bit lucky in some way in that the normal seasonal viruses like influenza, they weren't as much of a problem as they can be. And I think that again, like the government is just like a little bit concerned that if those come back, then the NHS could be under a lot more pressure again.
Right. All right, David. As always, thank you very much for your time and your thoughts.
Thank you, Sunny.
예방접종의 어떤 전파 차단 효과와 위중증 감소 효과들이 본격화되는 것들이 함께 맞물리면서 11월부터 좀 이러한 단계적 일상 회복 방안들을 적용하기 시작한다라고 하는 판단이기 때문에
We need to be able to have options available. It's exactly the right move at the right time.
More than 41% of the population here has been fully inoculated, while over 68%, as Soa mentioned earlier, has received one dose of the COVID-19 vaccine. Now, against this backdrop, authorities are plotting a phased return to normality amid global talk about the need to learn to live with COVID-19. For more, I have Professor Howard Lee from Seoul National University. Welcome, Professor Lee.
Thank you for having me back.
I also have Professor David Kwak from Suncheon University. Good to have you with us again, Professor Kwak.
Good afternoon.
Right, Professor Lee, let's begin with your thoughts then on an appropriate timing for Korea's shift from strict management, strict containment that is, of the pandemic, to targeted management of COVID-19 to allow for a more sense of normality that is in life here.
Well, every country is different. Well, Mr. Sajid Javid, the UK Health Secretary, a couple of days ago said any responsible government must prepare for all eventualities, as he outlined a booster plan for mostly those over 50. Well, actually, in the same vein, Mr. Boris Johnson, the UK Prime Minister, did not rule out the possibility of implementing Plan B, which entails vaccine passports, a mandatory wearing a face mask, and home working. I think Israel is not an exception in that matter too. Well, Israel's situation is a little bit trickier because the current prime minister vehemently criticized his predecessor, Benjamin Netanyahu, for earlier lockdowns. At the same time, Israeli people seem to be unwilling to impose stricter restrictions. So again, my point is that every country is different, so we have to decide our own decisions in an appropriate way.
Right. And speaking of that, Professor Kwak, what do you believe would be an appropriate or a productive path to exiting the pandemic for Korea?
Well, it's rather kind of tough for me to really pinpoint on what steps we need to take at this point, because as we are seeing quite high numbers of confirmed cases, we are also at the same time seeing quite unexpectedly low numbers of severe cases and mortality rates. Would that make us feel safe enough to actually go on to exiting plan already when we have vaguely inoculated about 40% of the population with completion of their schedule? I would like to, let's say, as Dr. Lee already brought out from some examples, I would like to also bring out some examples such as Israel, in the case of Israel and Denmark. In Israel's case, it was the model country up until about a month ago when they were showing high rates of vaccination. They were ready to go back to normalcy. They were ready to go back to the times that we used to have without wearing a mask and such. But then the inoculation rates stopped and became stale at around 60% or so. In comparison to the case in Denmark, where they have inoculated about 75 or slightly less than 75% of the whole population now, and have declared themselves that they would be going back to normal life as if they were managing COVID-19 as a regular flu. So where do we stand in that stance of having to have inoculated a certain portion of the population in balance to going back to the normal economic life that we used to have? We're still far behind those percentages. We're clearly lacking in regards to inoculation rate, even though we do plan to catch up on it before the end of October. Hopefully that'll be done. But until then, I think it's kind of premature for us to really start ahead and think about easing the restriction guidelines as to letting people who have the disease be isolated at their home quite freely, as opposed to the current measures that we're taking, isolating everybody who's confirmed the case in a social distancing quarantine services. So I think it's tough for me personally to exactly plan out what we should take in steps ahead, but I think the first step is actually basing our plan on having inoculated as much of the people as possible as soon as possible.
Right. And keeping in mind what Professor Kwak has just said, Professor Lee, authorities here have pledged an exit strategy will begin once 80% of the adult population is fully inoculated by the end of October. How feasible is this inoculation initiative in your view?
It is possible, but realistically speaking, I don't think it's something that is very likely. Being fully vaccinated means that at least 2 jabs or 1 shot in the case of Janssen, and also 2 weeks have to be passed. And we're in the middle of September, and we have only 1 month to be left until mid-October. So if you look at the number, the proportion of the population fully vaccinated in South Korea is only 40% or so. And the percentage of people who are vaccinated at least once approaches 60-something%, which is even higher than that in the United States. But what matters in this business is the percentage of those fully vaccinated. And the discrepancy between those two proportions indicates that South Korean government has had hard time securing enough number of vaccines in the past. So again, if you ask me if that is possible, yes, it's possible, but I don't think it's very likely.
Right. Aside from vaccination then, Professor Kwak, bringing the latest outbreak within a manageable or acceptable range has been highlighted as another requirement to perhaps possible transition to a sense of normality. What, in your view, would be an acceptable threshold?
That's a very difficult question for me to answer with a plain number once again. It seems like there was a survey that was done asking people at what rate of the daily confirmation rate would we feel safe to actually go back to the normal life that we used to have. And I think people answered in the majority that 100 or less of the daily confirmation cases would be the threshold that we would feel rather safe on. And I think the government is probably going to base their decision of making what steps to take on the results of the survey as well. But frankly speaking, even at the rate that we currently have at around 2,000 people or so of daily cases, aside from the problem we're having to isolate all the confirmed people in a socially distancing quarantine services, we're not having as much of the problem as it was anticipated in the medical sector, having to take care of people in the critical unit or people who are admitted for more severe symptoms of the disease. I am not saying that we should keep the daily confirmation case numbers as it is right now, but there would be a point that sort of is in between such low numbers that we would not worry at all of having confirmation cases, but also managing to have confirmed cases happen, but still be able to manage it in the medical sector that not many people or no one is actually dying from the disease. There would not be a specific number that I can pick out for that balance, but hopefully when we have enough people covered with the vaccination, obviously the severity rate and the mortality rate is going to decrease even further down. That's the point of time I think we'll feel rather safe to contain in the plateau of the manner.
Right. And keeping in mind what you just said then, do you suppose the daily tally within the 2,000 range right now here in Korea is within medical capacity?
Well, at least at this point, I don't think anybody is, I don't think anybody's really being transferred to other hospitals just because they're lacking ICU beds. We have enough capacity to cover people who need to be contained or looked after in a very critical care unit, and we have enough capacity to cover for a little more. So at this point of time, at around 2,000 people or so of daily cases, I think it's manageable, but I'm very careful to make that statement because it depends also on the situation. If we start to have, let's say, more elderly people come up with the disease or more people with vulnerability because of their immune systems or whatnot, then the situation will be different. So we have to sort of see the situation, sort of adjust to the situation as well, I guess.
Right. Professor Lee, during our broadcast back on Wednesday, there was much talk about the importance of having an oral drug against COVID-19 to ensure an actual return to perhaps pre-pandemic life. What are your thoughts on this?
I do believe oral drugs can play an important role in transitioning, which will make us to go back to pre-pandemic normal. At the initial time of outbreak, everyone was so frightened and terrified. So all of the therapeutic communities heavily focused on developing ways to reduce mortality from COVID-19. people are starting to realize that there has been an untapped area which could be of more impact to help patients at early stage go through the disease in a milder and an easier way. Oral drugs can definitely help that kind of transition. So having oral drugs means that patients do not necessarily need to be hospitalized, which will eventually reduce the burden, lift the burden on the hospitals, and that will facilitate the transition from pre-pandemic, the current status quo to the pre-pandemic normal.
Right, hopefully.
Yep.
Professor Kwak, what can you tell us now about the safety and efficacy of the current oral drugs being developed by several companies, including Merck and Pfizer, I think?
So the ones that Merck and Pfizer are currently studying are called molnupiravir, and the other one is called the ritonavir. So they are actually repurposed drugs, meaning they weren't specifically designed to fight against COVID-19, only COVID-19, but originally, if my knowledge is correct, molnupiravir was originally designed to, in the hopes that it will fight against Ebola. And then ritonavir was actually first designed to fight against HIV virus. But then they were repurposed for the use in COVID-19 because they had antiviral effect in themselves. And then actually, when in study, ritonavir was actually studied way ahead of the game in the beginning phase of the pandemic. It showed efficacy of slightly significantly useful in the manner of treating COVID-19 patients, but what's more probably attentive was that molnupiravir, the antiviral agent that was originally designed for Ebola virus, has shown great efficacy as to be able to block completely of the viral replication when given in people up to 5 days, and they saw actually no one having the virus anymore at the third day. And I'm very careful to make this statement once again because that was during the first and second phase of the clinical trial. So it has gone now into its third clinical trial, and through the first and second phase of it, they did not have too much of an adverse effect, very mild ones, only in a very minority of the people that had it. But what's more important is the fact that neither of the medication were able to stop people from dying from severe forms of disease. It was only effective when it was given in the beginning phase of the progression of the disease. So slightly less or more 7 days, within the 7 days of the start of the symptom. Anybody who had been admitted already when given these medications saw no effect. So we need to be careful when we're referring to these medications, how much an effect the medication would have is that the efficacy that they showed was only in people when they were having the beginning phase of the disease.
So they need to be taken earlier on then?
Absolutely.
Professor Lee, we again touched upon this issue a couple of times on the show this week actually. I'm referring to the cost of these oral drugs which Korea is seeking to secure, and it reportedly stands at around 900,000 won per patient. What are your thoughts on this pricing, and why does it far exceed the pricing of vaccines?
That's a very tricky point. Well, actually, there are many drugs out there that are more expensive than the Merck drug, molnupiravir, for example. It's simply because it takes time, money, and energy for many years. Well, on average, more than $3 billion have to be invested to have a drug developed and approved by the regulatory agency. And also, if you also look at the expenses that could be saved by drugs through a reduced mortality and hospitalization, also if you add that number by some economic losses by the patients who are not being able to work, I don't think it's so much expensive in that matter.
I see. Professor Kwak, where do local firms stand on efforts to develop our own oral COVID-19 drug?
So many Korean pharmaceutical companies also got into the game of finding out what drug actually might have an efficacy against fighting COVID-19 viruses. And they actually look into some, namely medications that were also sought after by foreign studies as well, namely camonsertib mesylate and nafamostat mesylate, and a company, I believe, I'm not going to name all the names of the companies here, but there was another case where they studied into clevidine, which was originally designed to fight off against hepatitis type B. So they have a very strong background in the sense that scientific scientifically speaking, because these are either antiviral medication or antiviral medication that has inhibition of protease activity. Protease activity is crucial to virus attaching to human cells, and obviously, when we logically follow the scientific method, it's easy to think that if we inhibit its activity, the virus is no longer to be able to attach to human beings. But now that was not actually so much the case in actual clinical studies. So even though it did show some efficacy, it was not good enough to actually prevent people from actually getting the disease. So I think many of the repurposed medication studies were stopped after either first or second phase of their clinical trial. There was another repurposed medication called Paramex, which is an anti-malarial drug, which is now going into phase 3 of their clinical trial, but also, once again, with their first and second clinical phases, it did not show significantly improved efficacy compared to people who hasn't received the drug. So we will have to see what happens afterwards with other pharmaceutical companies as well.
Right, we'll have to wait and see then.
Mm-hmm.
Professor Lee, Celltrion's Rekinora is an approved, homegrown drug, but it needs to be administered intravenously using an injection. Would it be difficult, Professor Lee, to perhaps modify this drug to make it taken orally?
Mm-hmm. Like Rekinora, well, it's a tongue twister. It's very hard to pronounce that name. It's an antibody. Antibody is protein. It's huge. So if you give antibody orally, first it will be digested first in the stomach. Well, maybe the other option is to give the drug intramuscularly, through the muscle, or subcutaneously, through the skin. But if you want to fight optimally against COVID-19 as fast as possible, it is very important to give the drug at a right speed. So in that sense, subcutaneous and intramuscular administration, I don't think that's a viable option. But intranasal or inhalational administration can be something that we can see they work, particularly because COVID-19, in the case of COVID-19, the respiratory tract is the place where coronavirus encounters first the human, the host. So my understanding is that Celltrion is currently performing a study, first time in human study with inhalational Rekinora in healthy volunteers in Australia. So hopefully by the end of this year, we might hear some news out of the study.
Right, so a nasal spray then to treat COVID-19?
Yeah, that could be another option. But to the best of my knowledge, no pharmaceutical company in South Korea has ever tried to study the efficacy and safety of intranasal, nasal treatment against COVID-19.
Right. And moving forward, Professor Lee, what efforts on the government level would better support the development of local oral treatments for COVID-19?
Well, I don't think I have any short and easy easy answer to that question. Drug development is a business. It needs support, finance, and all different kinds of expertise. It's more or less like running an orchestra. In an orchestra, every single player is important, no matter how big or small the part he or she plays. Likewise, in drug development, we need experts in every single field of drug development. Similarly, secondly, drug development for an orchestra to make sound great harmony, they need a conductor who coordinates every sector of the instruments. Likewise, in drug development, we need a central national sort of tower that organizes where to spend and where to go and how much. And that kind of decision has to be decided on a national level in a central way. Lastly but not the least, the orchestra needs financial support. Drug development, in terms of drug development, the patient and the government have to pay the price. If you are not willing to pay the innovation contained in a drug, who in the world wants to invest in drug development?
Right, a valid point there, of course. All right, Professor Lee, as always, thank you very much for your thoughts.
Thank you again.
Professor Kwok, thank you for your insights today.
Thanks.
Right, the universal understanding among informed experts is that COVID-19 inoculation will facilitate a return to some normality even amid the presence of the virus, that is. Also, do seek to get yourself tested should you believe you may have been exposed to the virus. Thank you for watching.